Just wanted to welcome you to our third webinar, and we're going to go over a few details right now. We are recording this for future viewing if some of your colleagues aren't able to join us at the moment. What I'd like you to see here is if you are asking questions, there's a Q&A box that you can type those in, but mostly that's used for our questions at the end of the session. I know sometimes we don't really look at the chat box, so just those questions for the speakers should be held there. And so you see in our window that's down in the red squares where you would go for typing that in. So I wanted to just kind of do a quick introduction over our webinar series in general for some of you joining the first time. And so we're talking about radon gas predominantly in this series, and these are some of the examples of some of the discussions we've been having and will be having about radon and how it relates to the International Atomic Energy Agency and our partner organizations such as the World Health Organization, the European Radon Association, and the CRCPD. So there are several, wanted to take a moment to point out the three we have the safety fundamentals, which are the principles that guide and lay out the information. Then we have more of the safety requirements, which fall in the safety standards. And so the one that relates to radon is the general safety requirements, part 3. And then to kind of elaborate what's shown in those shall documents is the should documents, which is the safety guides. And so the example here, you see the protection of the public against indoor exposure indoors to radon and other natural radiation sources. So this is, there are other guidance documents as well. There's the tech docs, and all of these documents are available on the IAEA webpage for downloading. And all of this information really gives you a way to provide for the application of these standards. And so that's part of what this webinar goes into. So we talk about why the radon conversations are important. Radon is found in soils, it can be found in building materials, it can also be found in drinking water, and well water. And so these three components are different routes for exposure for public, and so we want to kind of provide additional guidance over that. And we here at the IAEA have provided some additional support. So one of the examples here shown is a flow chart that's available to help with the development of the National Radon Action Plan or Radon Action Plan. This is just a screenshot, and it's very detailed. But there are, like I mentioned before, these and other documents are available on our website, as well as support to member states upon request is available. So we will not. Now we're going to kind of move into our move into our next presenter. And today we are lucky to have a representative from the World Health Organization. And so we're going to have Emily introduce herself. We're moving it over to her. So just one moment, and she'll be with us. So Emily.
Can you hear me?
Yes, we can. So if, tell us a little bit about yourself and your organization. We would appreciate it. Thank you.
Thank you, Michelle. Well, we are very pleased for the World Health Organization to hold this webinar in cooperation with IAEA. And for those of you who are not familiar with the work of the World Health Organization, I would like to let you know that WHO is the United Nations agency that deals with health and public health issues. We are this year 70 years old, and our main goal is for the attainment by all peoples of the highest possible level of health. And the way we work is very much defined by our core functions. First of all, to articulate evidence-based policy positions, including the ethical perspective, setting norms and standards as we do for ionizing radiation, shaping the research agenda, and also providing technical support to our member states, and monitoring the health situations around the world, including on topics related to what we will mention today on radon, and finally providing leaderships on topics that are critical to health, and also engaging in partnerships like the one that you see now, working together with a sister agency with the IAEA. Now, in terms of the words that you will see on this screen, all these words are very much related to the daily job of WHO. This is part and parcel of the organization, and all of these words have some relation to the topic of radon, be it regarding non-communicable diseases such as lung cancer, environmental health issues such as air pollution, workers' health, environmental health, housing, and risk communication. So you can see that the topic of radon is very much related to our core business. Now, it is very important to point out that 23% of all global deaths are linked to the environment. And we talk about the environment, we include the topic of air pollution, of water and sanitation, as well as radiation, be it ionizing or non-ionizing. And in that regard, the radon issue is also impactful. Now, with regards to radon specifically, our agency for research on cancer has classified radon as carcinogenic as early as 1988 and has reviewed the data again in 2001 and 2012. A landmark set of data was published in 2005 showing an association between the radon exposure and lung cancer in homes. And out of this data, we felt it was important for WHO to work further on radon, and we developed and published a handbook which a lot of you have contributed to, that has been translated in several languages. We also are trying to include radon in many other documents of WHO, mostly dealing with water safety and indoor air quality. And as was mentioned by Michel, we very much work with other international organizations to implement all the requirements that have been set in the International Radiation Basic Safety Standards, which include specific requirements on radon with respect to public and occupational exposures. Now, on the international level, over the past 10 years, since we published the report on 9 years, there has been a lot of work done, and this is what I would like to show through this slide. Both from a scientific point of view, and you will see that there is a number of publications from ICRP and UNSCEAR, but also from a regulatory point of view, with IAEA, with the European Commission, developing documents providing requirements. So these are all important actors dealing with the radon issue. And finally, I wanted to make the point that for us, we recognize that radon is a known contributor to ill health, especially when it comes to lung cancer. We see it as a second leading cause of lung cancer after smoking, and we would like to communicate the health risks to all concerned. From our perspective, an important stakeholder is the healthcare community. So in that sense, we very much welcome the document that Dr. Field will share with us today. Thank you very much.
Well, thank you, Emily. That was, I really appreciated how much you pulled everything together. And it is a field of cooperation, I believe. So I'm going to, right before we hear Dr. Field, we like to do a few polling questions, and we're going to try them today and see how they're going. So this is kind of to help us know who's here, who's participating, and get your input before we move to the main presenter. So I'm going to open up the poll. I'm already showing you the questions that are on there. And so just to kind of see who's in the audience. And I think we're going to just, right here, you're going to see a choice there for you to be able to vote, probably on your right-hand screen. So just go ahead and vote. There's the questions are, which best describes your position? Are you an elected official? Do you work for the government? Maybe you're in the building or private industry. You work with real estate. You're an educator or some other type of researcher. You work in the health or medical industry. Or if we just haven't captured you in any of these, then please select other. So, we'll be closing the poll in just a few more seconds. So just take your time and go ahead and answer. All right. We look like we've got about everyone is answered. We've got maybe about 15 people, so if you can go ahead and try getting your request in. And then I think we'll probably go ahead and close the poll. So all right, so we had about 62 participants, so about 2/3, I think, of the participants have responded. So we're going to share those results. So it looks like we've got a pretty good breakdown of about 30 to 40% working government, another 20% are educators, and then about 20% did not have an opportunity. They're in the other category. All right, so we're going to move on to our next question. And then, again, we may have some newcomers, so I'd like to know, are you the first time receiving any information? Do you have some basic knowledge? Have you been involved for more 1 to 5 years, or maybe you've been involved with radon issues for over 5 years? Well, I think we're going to probably close this poll pretty soon, so you just have a few seconds to submit your responses if you haven't. It looks like this time around we've had everyone has a little bit of experience with radon, and predominantly have been over at least a year or more in radon. All right, so for those of you who've been on our last webinars, this is a new question, our next one, and so it deals more with what we're talking about today. So if you can go ahead. So, have you ever had a healthcare provider, and we mean like a doctor, nurse, someone else when you go for a visit, ask you as part of your patient history or a health questionnaire that you received at the practice if you have tested or measured your home for radon? So if so, dude gives yes, if no, or maybe you don't remember. All right, I think we'll go ahead and close the poll for this time. We've got a few more seconds to get your last people to respond. Again, so when you visit your doctor or nurse and during a general exam, have you ever heard something about radon and testing your home for radon? All right, so overwhelmingly, you haven't heard anything from your healthcare provider. So that's a good start for our presentation today. We did have, it looks like one person has, so maybe later you can weigh in if you're willing to tell us if it was through a questionnaire or not, but I know that can be sensitive information, so no need to do that. All right, so we're going to go ahead and I've got one more slide before we kick it off to Bill. So I just wanted to share a little bit about Dr. Bill Field. He does work at the University of Iowa, and he's been actively involved with radon research for and communicating the health risk, and that's a big piece of it because I think not only in the health field, but how do we communicate the risk of radon? And so he's had over the past 25 years. He served on several groups in the U.S., such as the EPA's Science Advisory Board, and also is a U.S. presidential appointee on the National Institute of Occupational Safety and Health Advisory Board. I also wanted to point out that he was on the editorial group for the World Health Organization's Handbook on Indoor Radon, a Public Health Perspective, which was published in 2009. It's still a key document when it comes to public health and radon. So now I'm going to give it over to Bill and welcome today, and we really appreciate you having the opportunity today. So I think it goes to him.
Okay, I hope everyone is able to hear me. I think I may still be on mute.
Yeah, can you still hear me? We had you a minute ago, so I think you should be able to be heard.
Yes, I think I'm still on mute.
Nope, I can hear you.
Now? Oh, awesome, wonderful. Well, thank you for the nice introduction, and it's a real pleasure to be with you today. And I welcome people this morning from North America, and I wish a good afternoon to people elsewhere. It looks like predominantly it's afternoon for a lot of the people on the call. So the overview I want to give today is I want to talk about the content, scope and content of a new guide that we've been working on for quite some time. Common healthcare providers' misperceptions about radon, educational resources for radon for healthcare providers, and the development of a sample radon guides for use in healthcare settings, and examples of interventions healthcare providers can facilitate to reduce the burden of radon-related lung cancer. So I have a good number of slides today. I'd like to get through, but we'll go through these pretty quickly. And as you can see on some of the slides, we're still using the old English, the old unit for radon measurement of microcurries per liter. But I think in most of the slides we have the equivalent becquerels per cubic meter. I'd like to have some acknowledgments for the development of this guide, CRCPD. The guide was developed through a contract with CRCPD. They were really helpful during this process. Folks at the Environmental Protection Agency, Howard Cancer Consortium, and numerous reviewers and stakeholders who provided input into the guide. But really the focus groups that we assembled prior to developing the guide were instrumental in its contents, developing its contents for communicating the issue. When you talk about radon education for the public, there are a lot of stakeholders involved with informing the public. And just from our poll, you can see how involved healthcare providers are with at least asking you a question, whether or not you've tested. But we think medical providers play a key role in educating the public. For many people, the physicians or nurses that they see are one of the few scientists that they meet each year. And these are considered by most people to be credible sources for information about factors that can impact one's health. So we think they can have a lot of influence in educating the public. The first physician's guide that was developed by the EPA of the United States was developed back in 1993. And its purpose was to enlist physicians in a national effort to inform Americans about the serious health risks posed by indoor radon gas. And you can see 1993, that was first developed quite a few years ago. But if you do a Google search prior to working on our document and you put in radon and physician, the guide still came up. And the guide was still referred to by a lot of physicians in the United States. In fact, during some of our focus groups, they referred to the guide and some of the numbers within the guide that were very much updated. So it's obvious that we needed an updated radon guide. The first guide was developed in conjunction with the American Medical Association. They provided input to develop that guide. So what I want to talk a bit about today is really the new guide that's out there. There's a link to the guide if you haven't seen the guide already. And what really provided input for developing the guide was numerous focus groups of not just physicians, but physician assistant, nurse practitioners, nurses, and the people that you see when you go to that you would see when you go to a clinic that have the primary interaction with you when you first arrive at clinic. So we had a lot of different perspectives and focus groups that helped us to decide what the content of the document should be, the scope of the content, and different details and motivational factors that we could put in the guide. One of the things we really were interested in, we asked which statements. We had a lot of different information we were providing, and we were looking at statements that we thought could be motivational for physicians to take action on radon. So just an example, we gave the focus group a lot of different choices, A or B, or 1 or 2 in this case, and to see which was more motivational for them, being motivated to actually test themselves and then develop materials for their patients. And this was a typical question. Radon's estimated to cause about 21,000 lung cancer deaths in the United States. That was one statement. Or protracted exposure to radon is one of the top 10 causes of cancer mortality in the United States, which you find more persuasive from a risk perception standpoint. And probably not surprising, it was number 2. So we were just trying to think how to go back in and re-emphasize certain points and reword it so it would be more persuasive. And you can see here, this is cancer mortality in the United States, estimated deaths for 2018. And if radon-induced lung cancer was treated as its own disease category, it would rank about the 8th leading cause of cancer mortality in the United States overall. So they found a chart like that very persuasive and of great interest. A lot of times, physicians, when you talk to physicians about lung cancer, you can see that lung and bronchus is the primary cause of cancer death in the United States. And really, the number of radon-induced lung cancers pale in comparison to that large number. But when you put it from the perspective, the relative perspective of overall, how does that rate? You see that radon is a major contributor to mortality in the United States. The other question we asked, radon's estimated to cause about 21,000 lung cancer deaths. A similar statement that we had before, we compared it to this one. Lung cancer in never smokers, and never smokers, someone that's smoked less than 60 cigarettes in their lifetime, it's the definition of a never smoker, is one of the top 10 leading causes of cancer mortality in the United States. And that's something that they weren't aware of. I'd say 90% weren't aware that there were so many never smokers dying of lung cancer. So that was much more persuasive to them because they thought, well, we have to deal with these causes of lung cancer in never smokers. And if you look here, this is estimated deaths in 2016 in the United States. Lung cancer in never smokers, it's about 20,000 people die each year in the United States who have never smoked. So it's not just addressing the smoking issue in conjunction with radon. There's really a group of people out there that develop lung cancer who've never smoked. And we're finding more and more that there's some genetic differences among these folks, and it seems to be lung cancer appears to be increasing particularly among female population. So they thought that was a really interesting fact. Another radon misperception that the healthcare providers had was they really thought it was the radon gas causing the lung cancer. They weren't aware of the radon decay products. And as you know, it's not really the radon gas itself that causes the majority of lung cancers attributed to radon. It's really those two radon decay products, polonium-218 and 214, that decay by alpha decay that contribute the greatest radiogenic dose to the lungs. So that was something that they weren't aware of. Another misperception by healthcare providers is that the EPA's action level is really a health-based guideline, and the EPA's action level is 150 becquerels per cubic meter. We know the WHO guidance or the reference value is 100 becquerels per cubic meter. The average in U.S. homes is about 48, and then outdoor in the United States it's about 0.4, but it can go up to certain areas of the United States 1.2 year-round outdoors. And one of the interesting things was if it was truly a health-based guideline and radon was treated like the other chemicals that EPA regulates, we'd have to reduce outdoor air to get it down below 1 in 100,000 chance of developing a lung cancer. So it's not a health-based guideline, and that was something they weren't aware of. They really thought that if you had concentrations, persistent exposure down in this level, that you were relatively safe. And one of the other things they weren't aware of is in the United States it's estimated that 2/3 of the radon-associated lung cancers occur below the EPA's action level, so 1/3 occur above. And in this top graph here, if you look at the attributable risk, the attributable risk is about 14% for radon-induced lung cancers. And if you go down here to 4 picocuries per liter, and we know that radon is log-number distributed, so you have a lot of very low concentrations that you see, and then it slowly goes out with its tail, higher concentrations. If you eliminate these, you're eliminating about 1/3 of the radon-induced lung cancers. So when a home's mitigated, it's good that it, in most cases, just doesn't go below 4. The mitigation usually gets homes down below 1 picocurie per liter. So that was something that they found interesting. Another radon misperception they have is mortality estimates are based on old studies of underground miners exposed to high levels of radon gas. And we know originally Beer 6 and EPA's assessment of radon in homes, it was based on that, but they weren't aware that we have more recent information. And they thought there was not a consensus. They heard some people talking about there's radon's over low risk. There's no consensus, but we know we have consensus by a National Research Council, the EPA, and World Health Organization. And when we worked on the World Health Organization guidebook, it was fascinating to me that you have a room of about 50 people and representing 30 or 40 countries, and there was consensus among these different investigators and different public health officials from all these various member countries that we could come up with an agreed guidance for radon. And of all the processes I've been involved with, I think that was probably the one that had the most consensus in developing a consensus document. So there is a lot of consensus that radon does indeed pose a substantial risk. The physicians weren't and healthcare providers, they weren't also aware of the residential studies that have been performed in Europe and have been performed in North America. They thought that all the risk estimates were based truly on extrapolations or interpolations from the minor-based studies of high exposures, interpolating down to the lower exposures. They weren't aware that these case control studies have been performed all over the world, and the findings predominantly all show a positive increase in lung cancer associated with radon exposures at the EPA's action level. And the polling showed that even at 100 becquerels per cubic meter, you're seeing about a 2.2 or 2.7 microcuries per liter, you're seeing about an increased lung cancer risk. So the 2.7 is certainly below the EPA's action level, below a lot of standards or guidelines for the member countries. And then that was pretty much confirmed and supported by the findings of the North American studies showing a fairly substantial increased risk at 100 becquerels per cubic meter. They weren't aware of these studies, and these studies findings really coincide pretty well with the projections from the minor studies. One of the biggest misperceptions is when you talk to physicians in particular, they say, we see very few people coming into the clinic that have not smoked with lung cancer. And if you think about, in the United States, 160,000 people with lung cancer and 20,000 people that have never smoked, well, that's what they're going to see. So they're really sort of persuaded and biased in a way that this is really totally a disease due to smoking. And when we talk to them about radon and never smokers, was really one of the top 10 causes of mortality. That sort of changed your perspective. But if you change risk, if you examine relative risk based to smoking, most other risk pretty much pales in comparison to the risk posed by smoking. So reframing it a bit was very helpful. And as we talked before, estimated deaths in the United States, lung cancer, never smokers, about 20,000. Substantial number of lung cancer or cancer deaths overall are occurring from in never smokers. Other groups finding from the focus groups is providers have received very little training in radon decay, product exposure, radon testing, and there's very few scientific papers in the peer-reviewed articles in the scientific literature talking about it. And many of the papers are from many years ago, and there's a lot of conflicting papers. Some papers talking about hormesis, the beneficial effects of radon. So there was a real need in the focus groups for a good source of information that was reliable, science-based for the providers. One of the things that we've been working on is trying to get more papers out there for the general healthcare community. This is a paper that we published a few years back talking about occupational environmental causes of lung cancer. Very often when these kind of papers were published, the risk of radon was minimized compared to asbestos and other lung carcinogens. So we're really trying to get papers out there and put radon risk in perspective for physicians. Another thing that we've been working on is, this is a new book that was out just last year. It's called PARCS, Occupational Lung Disorders. And this book is the book that's used by most pulmonary physicians when they go through medical school and do their residency and fellowships in the United States. And we added a chapter in that textbook, and part of the chapter is occupational lung carcinogens. We really focus on the relative importance of radon exposure. So we're trying to get this kind of information in the medical literature so that when we write guidebooks and when we provide information, we have something that they can go through in the scientific literature to support some of the statements that we make. Other focus groups findings is that physicians and healthcare providers, not surprisingly, have existing relationships with cancer centers, cancer coalitions, and their partners. So we thought if we could work with their partners, that may be good inroads to talking with healthcare providers and having common collaborators that we could gain entry into educational opportunities for healthcare providers. One of the things in the United States is these National Comprehensive Cancer Control Programs. And back as far as 1998, CDC developed these control programs to help states reduce the burden. And one of the main focuses of the program developed by Centers for Disease Control was the creation of coalitions within each state. And a lot of states now have radon as an integral part of their coalition activities to reduce radon exposure. So the good thing about it, you start working with these cancer consortiums. One of the things, this is an example for the Iowa Cancer Consortium. When you start working with one cancer consortium, that cancer consortium already has existing relationships with a number of other organizations that have access to healthcare providers. So this is a wonderful opportunity to access these different collaborators and stakeholders with getting information out about radon and radon reduction and performing communication activities that would help physicians take a greater role in working with their patients to reduce radon-induced lung cancer. One of the other interesting findings from the pilot focus groups was that they have a very high interest in low-dose CT screening. In the United States, there's a national lung cancer screening trial enrolled 50,000 people a few years ago, and it found that low-dose CT screening was helpful with diagnosing lung cancers early. So they had a lot of interest in that. So the Screening for Lung Cancer U.S. Preventative Service Task Force have recommendations out that if you have a certain level of smoking, so if you're age 55 to 80 and you smoke for 30 pack years total, and you smoke within the last 15 years, you're eligible for screening. So a lot of individuals on Social Security are eligible for low-dose screening if they meet this criteria. And this really creates a teachable moment because people are calling in, they're concerned about their health, they're concerned about having the possibility of having a high risk of lung cancer, and a lot of times they're not eligible for the screening. And this is a really great teachable moment. You can, what we're trying to do is get information for these different centers that when someone calls in, say, well, you're not eligible for this program, you're not eligible to get a CT scan, but here are some things that you can do to reduce your chance of developing lung cancer. And providing radon information at that time when it's such a wonderful teachable moment, I think is an area that we have to work on in the future. And even if people do get the screening and they don't have lung cancer, here's another opportunity to say radon is another way reducing radon is another way to reducing your risk. So it provides a great opportunity. So here's the criteria recommended by the task force. And then the National Comprehensive Cancer Network, they developed guidelines that there's actually fewer pack years of exposure required for getting the exams if they have a history of high radon exposure. This isn't the one that's adopted by big agencies like Social Security and Medicare, but this is just shows the importance of radon in the decision of whether or not someone should get screened. So let me finally get to the guide, and hopefully by now you've had a chance to look over the guide and review the guide, so I'll go over this fairly quickly. Okay, so it's available on the Radon Leaders website. It has these different chapters, and one of the important chapters we thought we needed was the science behind the risk estimates. We need to put that in there and references in case they wanted to go into the underlying science. We've updated the map. A lot of times maps were not the test, so we have a relative risk index here. Rather than saying high, medium, low, we did high risk, moderate risk, and enhanced risk. New figure for radon entries in the document. Reviewers don't like the old table that had different denominators when we're looking at risk for smokers and never smokers. So what we did was we updated that table with a common denominator, and healthcare providers and the focus groups seem to like that better. We have included information like where's radon rank compared to other causes of cancer mortality, and then we have highlights within the guidance. Talking about the screening to try to bring some extra attention that radon can be considered a component within the screening programs. Then we have these different sections, radon health risk for individuals who have never smoked, just to highlight that this is a substantial percentage of people that develop lung cancer have never smoked. As I mentioned before, science of the risk estimates are really important. To develop the credibility. And small sections of radon testing, radon reduction in the guide, And then we develop sample guidance for healthcare sampling, sort of a description of what they can use when they interact with their patients. One of the findings coming out of the focus groups is that we really need to get a radon question within their electronic medical records, so that it gets included when they come for their first clinic visit or recurring clinic visits. Have you tested your home for radon? And we're working with some organizations now to do that. Developing other educational resources. So this is interventions to reduce radon-related lung cancer, asking patients, add radon testing, team up with CDC, and just some general guidance that we are providing to healthcare providers of steps they can take to have their patients become more aware of the risk posed by radon. One of the things we really urge physicians to do, and other healthcare providers, nurses and such, is to do radon testing themselves so they can model that behavior and be aware of what radon testing involves and how to interpret results. We also have the guide available at the Radon Leaders website, and we have another website, breathingeasier.info, that's hosted by the Iowa Cancer Registry, that has 2 videos that really serve as a nice support document, or nice support information for the written document. So I urge you to view these 2 videos, and this is from the perspective of a physician and the perspective of a patient. We have a shorter and longer version. So these are some additional information we have. And at this site, we have many of the documents and the science that support some of the statements that we have in the guide. What we're doing now is trying to work with medical organizations. In September, we have an editorial coming out that highlights the guide. It's going to be an American Family Physician that goes out to 180,000 healthcare providers in the United States. So we're trying to really do that kind of outreach, working with American Academy of Pediatrics. They're interested in distributing the guide and updating their information they have for their training for physicians. Working with American Association of American Medical Colleges, and they help with educating medical students. So they have a lot of several outlets that they want to work with us to try to get this information out. So this is just, I think, touching the surface. There's a lot of different groups that we hope to work with. But what we found out with all these organizations, it's really important to develop relationships with folks at these organizations. And there's usually the environmental disease group within there. So if you can develop relationships with them, it's much easier than to help communicate the risk posed by radon. So the next steps that we have are development of continuing education credits for healthcare providers that will be available nationwide. We hope to have continuing medical education for physicians, continuing nursing education credits. But that's really what the next step is that we're working on, trying to get the word out and the different types of publications, working with different organizations, as I mentioned. And if anyone has experience in their countries trying to get the message out or working with healthcare providers, I'd really appreciate if you email me, and be happy to share that information with others on the webinar. So I'd like to acknowledge finally the Conflict Radiation Control Program directors again, the numerous peer reviewers, the focus groups that helped develop the guide, call out to some specific people at the EPA, Susie Shimmick, Peggy Magnolia, Bill Long, and many other EPA staff, ARS leadership, and then some individuals that really spent a good bit of time reviewing the document, providing really helpful feedback. So with that, I'm happy to take questions.
Okay. All right. I'm going to kind of guide us through before we start doing some of the questions. Just wanted to remind everyone that they're up in the far right-hand corner, you'll see a Q&A box, and then if you'll and then down on the right-hand side, there's an area where you can type in your questions. And we'll be sharing those that we receive with either Bill or Emily if there's a question for either of them. I know we've assigned a few already, and I think so. I don't know, do you see those couple that you've gotten, Bill? Do you see them?
Oh, I see that. Okay.
Okay. So the questions, I'll kind of read them out so that everyone sees them. And we had a question that, has the American Medical Association reviewed this document? And if so, will the document will that be as part of the guide?
Right. So as I mentioned, the previous document was actually created in conjunction with the American Medical Association, and we did contact them, and their process is rather detailed to get them to comment on the guide. There's a lot of different working groups within the American Medical Association, and then there's some monetary cost to working with them for review of the document, working with that. But so we decided to work directly with some of these other groups rather than with the American Medical Association. We did receive feedback from them that once the guide was produced, they'd be happy to share with their members. But as far as receiving input directly, formally from the American Medical Association, that's something that we weren't able to obtain.
Okay. One of the other questions that I was thinking of, and I can't remember if you went over it today, was I remember in some of your other presentations you talked about developing a like a training for credit. I think maybe there was a slide on that. Could you go into refresher of that a little bit more?
Right. One of the things that I think is really important, we received input from this from the focus groups, and then subsequent to when the guide came out, what a lot of physicians and nurses would like is that there's a good bit of material to review. The document is fairly dense. We tried to make it very readable and understandable, but it's still a little bit of time commitment to spend the time to read that and possibly review the videos. So what we want to do is right now we're in the process of developing a CME that will have a lot of the information that's provided in the guide and in the videos, but it will also have some case studies where you have a patient presenting with a lung cancer. Just how do you assess what the risks are, what the contributions were that may have contributed to that lung cancer. But it's certainly something that we're working on right now. Right now we're probably further ahead working through the University of Iowa continuing medical education. But one of the downsides is that there's a $25 fee for anyone that's taking the course. And what we're trying to do now is expand that, using that as a prototype, and expanding that continuing education and trying to find another group that this can be provided at no cost to any healthcare provider that would like to take the CME or continuing nursing education credits.
Well, thanks. We have another question, and it says, in your work with the medical community, when you developed the guide, was there any discussion about the concept of the linear no-dose threshold?
Linear no-dose threshold. Well, and as I mentioned, in some of the focus groups, some of the questions we had, because there's a lot of literature out there. There's a lot of what listed in epidemiology, ecologic studies that, in fact, one large study in the past has shown that there's this inverse relationship between radon and lung cancer, when in fact it's really an artifact of, for some reason, there's an inverse relationship between smoking and radon. So counties that have higher smoking rates have slightly lower radon in those homes. So we think it's related to socioeconomic and building construction. So we received a lot of questions about some of the findings that didn't agree with the case control studies, but in most cases these were ecologic studies. We didn't get into linear non-threshold too much. The healthcare providers just wanted to know what the consensus was that radon is a cancer with no threshold. Cancer is monoclonal in nature, and with a lot of carcinogens, I think there can be a lot of repair. But with the number of we discussed this in pretty much detail. Some of the folks in the focus groups were radiation biologists that have a lot of expertise. So after discussing it with them and understanding that because cancer is monoclonal and there's a high number of double-strand DNA breaks with radon decay product exposure, that was pretty, I think, reassuring to them that there's likely not a threshold for radon. And we didn't really get into the whole linear non-threshold debate with the healthcare providers. And I think when you do that, you really need to look at different types of exposures differently, alpha, beta, and gamma. But we're pretty certain that for alpha particles with a high number of double-strand DNA breaks, that's something I think that could be very well justified that there is no threshold.
right, we have another question, and we may have one more. And if we don't get to a question today, it may be something that we can get to on a future webinar. So we have one that says, since you're creating film or long videos, would you be able to create some short ones to be able to use on social media, something that's like under a minute long?
Yes, we have a lot of the stock, I guess they call it B-roll, the stock footage from the videos that we already produced, but through the university here and different relationships we have with other organizations, that's certainly something that we'd be very interested in working on, especially if it could be directed in somehow to healthcare providers.
And we wanted to take a moment that we too created a recent video as well as devoting some of this on social media. But ours is not necessarily just about health. It talks a little bit more about radon. But all right, well, we're getting close to the end of the webinar, so I appreciate all of the questions, and just wanted to first thank our speakers, both from the World Health Organization, Emily and Bill with CRCPE. And then before we sign off, I wanted to remind everyone that this webinar was recorded. Unfortunately, we weren't able to do video this time. That's technology. But we will have a recording that will go up, as well as some links to some of the documents, and the presentation in the PDF will be available when the recording goes up. So at the top of your screen, you should see the direct page for the Radon webinars. If you were registered today, then you'll also get an invite when we schedule our next one. We're looking to have one in July, and hopefully we'll be incorporating any questions that we weren't able to answer today. So we again appreciate all of the connections that we've had today, and we do thank you for your participation. And Emily and Bill, thank you again for all of your work on this presentation today. Was there anything else you had in closing?
Well, I would. This is Bill. What I would say is that if there are questions that weren't addressed, I'd be more than happy to email me and be happy to answer questions, or if there were some suggestions for reaching out to healthcare providers that maybe we haven't considered, that would be extremely helpful. Or even if you have any comments on the guide, suggestions for future improvement. The great thing about the guide is it's hosted on the website, so we'll be able to update it every year with new cancer statistics information and make changes as we go. So we consider it a living document that will constantly be improved over time.
And if there are viewers after today, this will be a good opportunity for them to weigh in and give you feedback in the future as well.
Exactly.
And Emily, anything from you?
Yes, I would like to echo your thanks to Dr. Phil for an excellent presentation, and this, I am sure, will prove very useful in the US, and we hope to work together to develop something on an international scale. Thank you.
Well, again, thank you both, and I always want to give a shout out to the tech support in the room. You can't see Linka. Without her, this event would not happen. So again, thank you everyone, and hope you enjoy a beautiful summer or winter day, and afternoon or evening. So again, look forward to maybe seeing you in July. Thanks again. All right. Bye.